Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 127,940 confirmed cases of COVID-19 in Canada and 42,195 cases in Ontario. Chatham-Kent has 362 cases and Sarnia-Lambton has reported 338 cases. Michigan now has 102,017 cases with 13,631 cases in Detroit. Today, we are reporting 2,521 cases of COVID-19 in our community, an increase of 4 new cases from yesterday. 2 are close contacts of confirmed cases, and 2 are still being investigated by our nurses. Overall, 26% of our cases are between the ages of 20 and 29 years, and 23% are between the ages of 30 and 39. 65% are male and 35% are female. 2,368 cases are now resolved and 81 cases are active and being followed by our health unit. 6 people are in the hospital with 1 person in ICU. Our community has lost 72 people to COVID. 50 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. As well, there is 1 outbreak in the manufacturing sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Assessment and testing centers include Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Testing will also be available September 3rd and 4th at the Sportsplex at St. Clair College. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current case counts and information. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Mark, can you hear me?
Yeah, we can hear you now.
Okay, sorry. So I'll start again. Good morning and thank you for joining us. Now that we have moved into stage 3 of reopening, more businesses are open. There are more opportunities for public interaction and more opportunities for potential community exposures to COVID-19. Reopening in stages allows for a slow relaxing of restrictions to protect the public's health, ensure that as a community, we are able to reopen safely and manage risks. After many months of restrictions, we are all anxious to get back to normal, but there is and must be a new normal for all of us. Over the weekend, the Windsor-Essex County Health Unit issued 3 notification alert the public to potential exposure to COVID-19. When an individual is confirmed positive for COVID-19, Public health conducts a case investigation, assessing exposure risk, and identifies close contacts. Potential exposures for COVID-19 occur when individuals visit public settings while infectious or symptomatic. To stop the spread of COVID-19, residents must continue to adhere to public health measures and advice. It is critical that residents know the symptoms of COVID-19 and stay home when they are ill. Symptoms of COVID-19 can range from mild to severe and may be easily overlooked, such as headache or runny nose. Ignoring these symptoms has the potential to put other people's health at risk. The Windsor-Essex County Health Unit will continue to issue exposure notification anytime there is an identified risk to the public, and in cases where we are unable to identify and contact all individuals at risk for exposures. Businesses and locations accessible by the public will be posted to a new public exposure page on our website and will include date of potential exposures. These notifications do not mean that the businesses was not following public health measures and recommendations. In fact, low-risk exposures are likely because good public health practices were in place, therefore limiting the risks. To receive public exposure notifications, residents can subscribe to our website to receive any email anytime there is an alert. Alternatively, follow us on social media to receive notifications. When a notification is issued, individuals that visited an identified business on the specified date or dates are asked to monitor themselves for symptoms of COVID-19. Take Ontario's online self-assessment tool. If you develop symptoms, contact your healthcare provider. Visit an assessment center for testing and self-isolate. Let us all continue to stay mindful, stay safe, and stop the spread of COVID-19. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from Windsorite?
Good morning. It was reported today by Teresa that 6 people were in the hospital with confirmed cases of COVID-19. But this morning, Windsor Regional Hospital is actually reporting 13 patients with confirmed cases. I'm just wondering what the discrepancy might be there.
So some of these numbers obviously are updated in a timely manner, so what we are seeing is there are a combination of transfers that happen, and by the time all these transfers will pull all this number together in an appropriate database, then we can share that. A lot of that information that we are pulling, it is pulling directly from the provincial database, and by the time it's updated, we will do that. And part of that is also the migration that we talked about to the new system. And but right now, what we reported is accurate as of that's in our database at this time. But when all of this information is updated, it will be reflected accordingly.
Okay, thank you.
Any questions from CBC?
Yes, hi, Dr. Ahmed. So I know that on Friday, some businesses were upset about how they were notified of potential exposure there. How's the health unit planning to change that process?
Well, I think our priority is always to inform the public, especially if there's any risk. So what happened over Friday was an exposure that already occurred about a week ago. So the timely release of information out to the public was critical in that situation, we feel. And as we continue to issue these type of alerts, obviously there are processes in place that we reach out to the businesses and ensuring that they are also in the loop and aware. And it's not a reflection of how the businesses were performing. It's about the public health. It's about the public who visited these facilities. So it's, again, I would just want to reemphasize that the fact that it's not a reflection of the business. It's about the word getting out. And if there is any opportunity for us to make that connection in a timely manner before we go out to the public, I think it's always appreciated and it's always understandable. So moving forward, as we said, our processes will definitely make sure that the businesses and everyone is aware. But sometimes just the urgency of releasing that information is critical, just because of the timing, and we can understand the concerns that these businesses have raised. But knowing that those words were important because we were getting into the weekend, and it was already the exposure happened a week ago, so we felt that it was important that this goes out. And moving forward, we will continue to refine our process to ensure that the timely notification happens for all, including the businesses and also for the public.
Thanks. And then just a second question, which you kind of already talked about today, but knowing that there's been quite a few of these notices of exposures at stores and restaurants the past few days, why do you suspect that we're seeing this spike? And is this maybe reflective of people easing up on safety precautions?
Well, it's a bit of both. As we said that, when these businesses are now opening up, there are more opportunities for people to go out and interact with each other. So that's one part of it. And the second part of it is the responsibility and being mindful of your own symptoms. If you're not feeling well, you should take precaution. You should stay home instead of putting others at risk. So what happens in these type of situations when someone who is symptomatic, and if they have visited these facilities, obviously there is a risk there. Based on our determination, we have identified those risks as low risk, but it can easily be a high risk situation. So from those who are visiting, they need to be mindful of their symptoms. And for anyone else who is just visiting these places, ensuring their safety is also critically important, and following those public health measures is also important. So anyone who is going out in any of these businesses, establishments, commercial places, if they're maintaining their physical distancing, that's the best thing that they can do at all times, and that's the critical information. Anyone who is required to wear a mask in some of these settings, if they're wearing those masks, they are now increasing their likelihood of, decreasing their likelihood of contracting COVID. So those are some of the measures that I think it is important and it's worth reminding to residents. Moving into stage 3 doesn't mean that the risk is low now. What I see is the risk is obviously it was increased. There's a low level of transmission that's happening in the community, which is a good sign, but it can easily change if people are not following those recommendations and instructions that we've been providing to them for quite some time now. So it is important that we all do our part as businesses, as individuals, and also as as a community member, that we owe it to all of us, and we should all be taking precautions. We should all be working together to ensure that our community is safe.
Thanks, Dr. Ahmed.
Any questions from AM 800?
Dr. Ahmed, the new section on the website, like you mentioned, what will that feature? So if there's an exposure at a business, that business would be on this section of the website?
Yeah, so key pieces of information is the exposure date and the business. And that would help to make a determination to individuals that if they on that specific date, if they visited that business establishment, and if they're feeling something different, any kind of symptoms, then it should trigger them that they may need to either self-monitor their symptoms, or they need to go to an assessment center to get testing done. So it just increases your concerns and risks, and I think people should be watching that, especially who are out and about quite a lot. And I can already see that the 2 alerts is already posted. We hope to get all the other alerts on our website and keep the community informed.
Sorry, so just before I ask my next question, that section of the website is live right now?
Last I checked in the morning, it was with at least 2 alerts that was issued over the weekend. It was live. So if you go on to our main webpage, and there is a public exposure notification that's already out there.
And finally, I'm not sure if you can get into this, but on Friday, during your presentation, the pie chart for the municipalities under the last 7 days, LaSalle took a big jump. It had 27%. We're hearing, and we received a tip at the station, that a main reason for that is an individual hosted a party that this individual had symptoms or was showing symptoms and still had a party, and then people went to his or her house, and that's where all these close contacts are coming from. Can you talk about that? Is that accurate, that a lot of these close contacts in the LaSalle area are from people who went to a party that an individual had symptoms?
Well, I cannot get into the specific details of each of these situations, but what we have noticed is definitely there has been an increase in the number of contacts of many of these cases, and a lot of these are resulting from these gatherings, social gatherings, and which is a concern. And we have been identifying this concern for some time now, reminding residents that moving into stage 3 doesn't necessarily mean that all these precautions are gone. And some of the measures that continues to stay in place is limiting the number of contacts, limiting the number of close contacts, which is 10. And it doesn't mean that when you're talking about indoor gathering limit of 50, it doesn't mean that 50 people can congregate in one house in a small setting where there is no physical distancing. So physical distancing continues to be the most important measure. And that's what we are seeing. So I cannot speak specifically to one instance, but in general, this is what we are noticing, and we are reminding people that it is a risk, and we all need to be mindful and should not be engaging in these parties, especially when physical distancing cannot be maintained.
Okay, thank you.
Any questions from Blackburn?
It's probably too early to say, but all these places that you've issued these exposure notices for, there hasn't been any evidence so far of transmission at these sites?
Not that we have identified. We have identified already that these are low-risk exposures, but obviously we cannot rule out any potential risks. And knowing that especially in these type of large settings, there are always risks. And so far there is no evidence. And as we mentioned that, these businesses were in good shape in terms of public health compliance and measures, and which is a good sign as a community that all these businesses and establishments, if they're also following all the public health recommendations, the risk to public can be low. And this is what we like to see. And again, the onus is on all of us, not just on the businesses, but also on the individuals who are visiting. And we all have to work together.
Thank you.
Any questions from Windsor Star?
They have all been asked, but thank you.
Okay, any more questions from Windsorite?
A few of our readers have asked what the difference is between a workplace outbreak and a public exposure notification for a workplace. I wondered if you could maybe just clarify that.
So when we're talking about a workplace is a workplace. That means, the people who know we have a good handle on who's coming to that workplace. It's not open for public. And the workplaces have their own guidelines in terms of how they're keeping their employees safe. They have to follow the occupational health and safety requirement. They have to ensure that everything that they have in their workplace meets the standards and compliance requirement to keep their workplace safe. And when we're talking about these type of public exposure notification, those are the notification, or those are the exposure where anyone can just walk in and can be potentially exposed. And recognizing that in the situation when we have a workplace, we have a good record, we have a good handle on what kind of practices are there at that workplace, who is coming to that workplace, what are some of the individual risks, who sits where, et cetera, et cetera. So all those details are there. Public exposures is happens when we don't have a lot of those details. We have a lot of uncertainty in terms of what kind of interaction, what kind of exposure happened. And within the workplace, even if there are some risks to an individual who may come in contact with someone with a confirmed case, that workplace already works with public health to do everything that we ask everyone else to do. So it's not a matter of the reducing the risk. So the risk is in both places, but public exposure notification happens when we cannot say with certainty of who visited and what kind of exposure happened. And also, just as a general public, if we are out there, I think it's important that we need to know about any potential exposure risks in any of these places.
Okay, thank you.
Any further questions from CBC?
Yes, one more. I know that Windsor Public Library actually opened up 3 of their locations today in like a trial run. They said that they're not keeping a list of people for contact tracing purposes, and I just wanted to know what you thought about that. Should they be keeping a list of patrons who come in and decide to stay in their spaces?
I think it's always a good idea to keep track of who's coming to the facility in case of any potential exposure. And this is one of these best practices that we have put forward in many of our guidance documents. So I think it's a great tool for contact tracing, and it helps public health to reach out to individuals, especially if they're identified as a close contact. And if not, then obviously we have this public exposure notification that we can use to support individuals in monitoring their symptoms or referring them to go for a health assessment or to get a test done.
Okay, thank you, Dr. Ahmed.
Any further questions from AM 800?
Not a question, just a request. Tomorrow, Teresa, do you mind giving us the numbers for complaints, just updating us on that?
Yep, sure. I'll do that.
Thank you.
Any further questions from
From Blackburn?
No, thank you.
Further questions from Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.